Bismillahirrahmanirrahim. Assalamu alaikum dear friends. Hope you will be fine with good health. In this video of pharmacology and therapeutics, I will discuss about anti-anginal drugs. This is part 1, part 3, and I am Dr. Abdul Malik, PhD Pharmacology, Assistant Professor, College of Pharmacy, University of Sargodha. In this, I will discuss about the treatment of anti-anginal drugs available and treatment methodologies, which drugs have been used for this one. And the fourth part will also include the medicines or drugs available for angina. So let us start now. Please subscribe my channel for more updates and watch this video up to end. And we are going to start the treatment of angina pectoris basically. So what are the treatment methods available for angina pectoris? We have to modify the risk factors. For example, smoking should be inhibited or prohibited, blood pressure should be controlled, and lipid profile should be checked properly. Antiplatelet drugs, including aspirin, sometimes clopidogrel, prasugrel, or ticagrelor, should be given to the patient for the treatment of angina or other cardiovascular problems. So we go towards another drugs that can be given to the angina pectoris patient is beta blockers. Beta 1 blocker is basically given. Some non-selective are also available. Nitroglycerine and calcium channel blockers for symptom control. Angiotensin converting enzyme, ACE inhibitors, and statins should be given for cholesterol and blood pressure control. Revascularization if symptoms persist despite medical therapy. So now we go toward the basic anti-anginal drugs by class. Only first class is very important, and very quick response of these drugs are given. So organic nitrates are commonly used for anginal symptoms, especially for stable angina and other types of angina. But an unstable angina have no response for organic nitrates. Now we go toward the drugs available: amyl nitrate, nitrile, nitroglycerine, isosorbide dinitrate, isosorbide mononitrate. These are the longer one. Nitrates, these are the shorter duration of action, having very short duration of action. So we go to the other type, that is calcium channel blockers, non-dihydropyridine, verapamil and dantiazine, and dihydropyridines including nifedipine, nicardipine, amlodipine. These are the drugs commonly used for anti-anginal drugs. Now we go towards the beta blockers that are commonly used, including propranolol. This is the prototype drug, and atenolol, metoprolol, nadolol, and pendolol are given. Some other drugs have not been discussed, for example, ranolazine, sodium channel blockers, and some other drugs that have not been discussed here. I will discuss in the next section. So here are the guidelines that should be taken the action for anti-anginal drugs, and here is the drug classification you can see in the table. First, we see the beta blockers: propranolol, atenolol, bisoprolol, metoprolol. Calcium channel blockers, including dihydropyridines, including amlodipine, nifedipine, fluoxetine. Calcium channel blockers, including non-hydropyridines, including daltiazine, verapamil, and nitrates. Nitrates, including nitroglycerine, isosorbide dinitrate, isosorbide mononitrate. I have also discussed in previous previous slides. And now sodium channel blockers, including ranolazine. Here is the guidelines. You can see, you can use this one: stable ischemic heart disease, guideline directed medical therapy, including emphasis on lifestyle modification for cardiovascular risk reduction. Here is the anginal symptoms present, then urgently or quickly sublingual nitroglycerine should be given for immediate relief. So these have very short acting, and if there is a relief or properly relief happen or not, then we can use the beta blockers for prevention and for the treatment. If inadequate relief after titration, then add another drug, including calcium channel blockers or long-acting nitrates. If inadequate relief is there, then add another drug, that is ranolazine. So this is the basically guidelines available for the control of the angina. So what are the immediate relief drugs available For the symptoms in which glycerine trinitrate or GTN, we can call right GTN. So immediate relief from symptoms. Common side effects include postural hypotension. Basically, these relax the. I shall explain the mechanism of action of GTN in the next slide. But we are discussing about the common side effects, including postural hypotension, tachycardia, throbbing, headache, dizziness, and flushing are there, and precautions are given for the sublingual tablets to keep under the tongue and do not chew or swallow it. Seek medical care if pain persists after a total of 3 doses in 15 minutes. Avoid abrupt withdrawal of the drug. So here is the mechanism of action of organic nitrates. These have the short acting, including nitroglycerine. If we administer sublingually or patches or other form, this will form nitrites in the body, and it converts nitric oxide or stimulate nitric oxide in the blood vessels, and this will also act as cGMP, and further secondary messenger has been formed, and further dephosphorylation of myosin light chain, and there is a vascular smooth muscle relaxation in the coronary arteries. Where there is a spasm, where there is a blockage, this will relax the coronary muscles, coronary blood vessels. So there is a relaxation of the angina. So this is the structure of the nitrate or nitroglycerine, and available of trade name is available by Pfizer, nitrostat, glycerine, nitroglycerine sublingual, 0.6 milligram per tablet. So now we go toward the preventing anginal attacks. These drugs having beta blockers basically first is used common. I will discuss the mechanism of action in the next slide, and here is side effects basically: fatigue, coldness of extremities, sleep disturbance with nightmares, blood glucose disturbance, gastrointestinal disturbance, bradycardia, heart failure and hypotension, and the conduction disorders, peripheral vasoconstriction and dizziness can happen by using this beta blockers. So what are the precautions should be avoided in diabetes, obstructive airway disease, myasthenia gravis patient? Need dose adjustment in renal and hepatic impairment, contraindicated in patient with second and third degree heart block. Avoid in patient with uncontrolled heart failure, asthma, marked bradycardia, hypotension, severe peripheral arterial disease, and certain conduction disorders. Avoid abrupt withdrawal. Abstinence syndrome also happen from this one. So coming to the mechanism of action, the therapeutic effect of beta adrenoreceptor blocker in angina pectoris can be ascribed to an inhibition of beta 1 receptor mediated stimulation of heart rate and myocardial contractility, resulting in an improved oxygen supply demand balance in the myocardium. So here is the mechanism given. You can see there is a decrease. Beta blockers will happen, cyclic GMP, and there is a decreased heart rate, decreased contractility, decreased afterload, and there is a decreased demand of oxygen. In the other hand, it increases diastolic perfusion, and there is a increased oxygen supply to the muscle. So these are the mechanisms of beta blockers. Now we go toward the calcium channel blockers. Basically, I will discuss the mechanism on the next slide, and here are the side effects. This calcium channel causes constipation. Some of the drugs that causes constipation and headache, tachycardia, dizziness, rash, fatigue, flushing, nausea, edema, notably in ankles. Precautions include caution in first degree AV block, contraindicated in a patient with severe bradycardia, second and third degree AV block, sick sinus syndrome, acute porphyria. Avoid grapefruit juice when taking certain calcium channel blockers such as nifedipine and rapamycin. This can interact with this grapefruit juice. Here is the mechanism of action of calcium channel blockers. So you can see these ventricular and myocardium this decreases contractility, decreases oxygen demand. In SNO, this decreases heart rate. Basically, calcium block is there, and there is a decrease in contractility of the heart. So oxygen demand will be reduced, and there is a vasodilation and increase oxygen supply to the tissues. Basically, these are the mechanism, and further, these causes decreased blood flow, afterload will be reduced, and myocardial oxygen demand is also decreased. So long-acting nitrates, including isosorbide dinitrate and isosorbide mononitrate. So what are the major side effects? Postural hypotension, tachycardia, thrombing headache. I have already discussed in the previous short-acting nitrates, organic nitrates. And here is the caution in severe hepatic and renal impairment, contraindicated hypersensitivity to nitrates, hypotensive conditions, and hypovolemic, hypertrophic, cardiomyopathic, aortic stenosis. Avoid abrupt withdrawal. So these are the basically long-acting nitrates. I have already discussed the short-acting nitrates like nitroglycerine. So mechanism of these are similar. So some derivation of antianginal effects of nitrates are available in different formulations. Basically, we see the dosage forms and administration route of this nitroglycerine. Nitroglycerine is available in translingual spray, sublingual tablets, intravenous injection, intravenous infusion, oral extended released capsules, and transdermal patches are available. These are the formulation, and you can see the onset and duration is also given. Long-acting nitrates include isosorbide mononitrate. This is orally given and having 6 to 8 hours duration. Nocorandil and long-acting nitrates are vasodilatory drugs used for chronic stable angina pectoris. Both exert anti-anginal properties via activation of nitric oxide signaling pathway, triggering vascular smooth muscle relaxation. Basically, these are the mechanism of action of these drugs. So we have finished the third part. Thank you very much for your attention, for your watching this video. Please, I will discuss the fourth part, in which different drugs will be there. Remaining drugs will be discussed, and newer drugs available for anti-anginal drugs. So thank you very much.